Welcome, everyone. We'll take just a moment for allowing attendees to log on as we get ready to begin tonight's program. Thank you for your patience, and I look forward to having an awesome discussion and presentation this evening. So, good evening and happy Black History Month. I am Imani Capri, and I will be your host and moderator for this fourth and final webinar in the fifth annual Black History Month Brain Health Webinar Series. Again, I am Imani Capri, host of the international award-winning radio show Conversations in Courage. I'm also a certified Reiki practitioner, meditation coach, speaker, and Civil Service Commissioner with the City of Maple Heights in Maple Heights, Ohio. This program is presented by the Cleveland Alzheimer's Disease Research Center, or CADRC. This federally funded grant brings together the Cleveland Clinic, University Hospitals, Case Western Reserve University, the Lewis Stokes VA Medical Center, and Metro Health Medical Center to function as a research center without walls, dedicated to advancing the study of Alzheimer's disease and memory loss. To continue with our weekly series, we'll begin tonight's program with a brief celebratory presentation highlighting African American pioneers and their accomplishments. This presentation will also provide background and context related to tonight's topic. Following the presentation, we will then transition into a discussion with our esteemed panelists. As a reminder, this is an interactive series. So throughout the session, we will ask the questions that you, our audience, submit to us. So we encourage you to submit questions at any time using the chat or Q&A features. Tonight's discussion is entitled Everyday Technology and the Brain, Empowering Health While Avoiding Harm. And we are pleased to be joined by Dr. Faye Cobb Payton and Dr. Lloyd Talley. But before we begin the panel discussion, it is my pleasure to introduce Gordon Williams, who will deliver tonight's celebratory presentation. Gordon Williams was raised in Cleveland, Ohio, and obtained his BA in psychology at Cleveland State University. He was first introduced to the research field during his time in undergrad, working with Dr. Kenneth Vail, focusing on existential psychology research from 2014 to 2016. From there, he was hired at university hospitals in the Clinical Research Center as a clinical research coordinator in 2018, and finally settled in the Neurological Institute Clinical Trials Unit, focusing on stroke as well as brain health and memory, the department in which he currently works. Gordon, it's all yours. Take it away.
Thank you so much for that introduction. I really appreciate it. Welcome to everyone that's here at our webinar, week 4. We really appreciate you folks taking your time to stay with us. If you guys just give me a moment, I'm going to move over to our PowerPoint presentation, and then we can go ahead and get started. So one moment. All right. So I'll go ahead and I will start the slides. Oop. Let's move this out of the way. There we are. So as Amani had mentioned earlier, today's webinar will be focusing on everyday technology and empowering brain health while avoiding harm. To begin, we'll have our historical highlight, Dr. Mark Dean, inventor and computer engineer. He holds patents for being the co-creator of the IBM personal computer released in 1981. So Dr. Dean was born March 2nd, 1957 in Jefferson City, Tennessee. He was introduced to engineering by his father, whom controlled electrical breakout box equipment for turbines and spillways. His father would also bring him along on work trips, which sparked his interest in engineering. And during his childhood, Dean and his father built a tractor from scratch out in their yard. During the 1970s, he built his own personal computer while in high school. And in 1982, he earned his master's degree in electrical engineering from Florida Atlantic University. And shortly after that same year, he joined IBM, standing for the International Business Machines Corporation. He helped design IBM's first personal computer, a 16-color graphics adapter, and hardware that allowed computers to connect to monitors, printers, and other devices. This helped IBM gain a foothold into the microcomputer market that was mostly dominated by companies such as Apple. During this time, he became the first African American to become an IBM Fellow, which was the highest level of technical excellence at the company. In 1992, he earned his doctorate in electrical engineering from Stanford University. From there at IBM, he led a team of engineers to create the first gigahertz chip in 1999. The gigahertz chip is responsible for allowing modern day computers to complete multiple activities at once, such as having multiple internet tabs open at the same time, as well as video editing. In 1997, he was inducted into the National Inventors Hall of Fame. Currently, he holds more than 20 patents, and his most recent one was in 2019 for method and apparatus for providing real-time monitoring of artificial neural networks. Next, we'll take a little bit of time to talk about our topic of the day, everyday technology in the brain. Artificial intelligence and other technology can provide access to early neurological diagnoses and other specific resources based on your own algorithms. An example of this is that many healthcare professionals utilize is actually telemedicine. It expands access to healthcare to people that may live in rural areas that don't live close to healthcare providers. Portable diagnosis equipment, i.e., portable blood pressure cuffs, or relevant to neurology, low-cost EEG devices that can record brain activity and assist with any neurological disorders. Wellness apps that can assist with relevant issues such as fitness, nutrition, diet, sleep tracking, mental health, and as well as medication. And finally, community platforms which can provide peer support and destigmatization, such as social media platforms. Think about it as an online AA meeting. With all these advantages in technology, there's still limitations and flaws that can be found when utilizing them. Generative AI, like ChatGPT, generates information based on what already exists. So while it can pull information from peer-reviewed articles, it can also pull information from stereotypes as well. Generative AI hallucinates, which means it'll create data on what's plausible and not necessarily data that's true. For instance, AI-driven healthcare tools often assign lower risk scores to Black patients due to biased data, which causes health disparities. This technology is not only limited to AI, however. There's also limitations on healthcare devices. For example, neuroimaging devices such as the EEG can underperform when used on darker skin tones and textured hair, which can cause inaccurate results. This is why it's so important for people of all backgrounds to participate in clinical trials, so access to care is equitable amongst all people. Our final point, the digital divide. There's limited access to internet across amongst rural, low income, and a lot of minority communities. So building inclusive and culturally competent solutions. So what are some of those solutions we can take to some of those issues? To combat AI bias, developers must prioritize diverse data sets and work on combating and eliminating biases and add inclusivity for health tools and research. Addressing cultural competence and engaging with communities to create tools that can reflect unique health needs and experiences. To address the digital divide, investing in broadband infrastructure and improving internet access to underserved communities, encouraging policymakers to enforce regulations for neutral data and promoting equitable access to digital health resources so it's equitable to everyone. Now we'll just take a look briefly at technology in the news now. And this is something that's actually very recent. Currently, it's media awards season, and the BAFTA Awards, which stands for the British Academy of Film and Television Art, were held this week back on February 22nd. During the ceremony, actors Michael B. Jordan and Delroy Lindo took the stage to present an award. At that time, a member of the audience with Tourette's syndrome expressed a tic in the form of a racial slur. For anyone that may not know what Tourette's syndrome is, it's a nervous system disorder characterized by involuntary repetitive movements and vocalizations that are known as tics. This made headlines on news outlets, and Google's artificial intelligence promoted articles online using the slur uncensored. In turn, one of the disadvantages of AI, as mentioned earlier, is AI cannot distinguish right from wrong, and it learns from existing data, including biased and harmful content. This is why more intentional design and engagement with other communities is important when developing these technologies. It's the most effective way for harm reduction. Last but not least, these are the sources that we utilize for today's presentation. And I would like to thank you all for your time. And right now, I'll hand it on back to our host. Thank you all so much.
Thank you, Gordon. So now it's my pleasure to introduce tonight's panelist. We have Dr. Faye Cobb Payton and Dr. Lloyd Talley. Dr. Faye Cobb Payton is the special advisor to the Chancellor for Innovation and a full professor of mathematics and computer science at Rutgers University, Newark, where she also leads the Institute for Data, Research, and Innovation Sciences and holds an affiliate appointment with Rutgers, New Jersey Medical School. She is professor emerita at North Carolina State University and previously served as a program director at the National Science Foundation, where she launched the SciSe Research Expansion Program and contributed to several initiatives such as AI fairness, equity, accountability, and transparency. She has served on numerous national boards and committees, including the National Academies and the National AI Research Resource Pilot, and has authored more than 150 peer-reviewed publications on data quality, responsible AI, healthcare, and innovation. Before academia, Dr. Payton worked in industry with IBM, EY, and Time Inc. She holds an MBA and BA from Clark Atlanta University, a BS in Industrial and Systems Engineering from Georgia Tech, and a PhD in Information and Decision Systems from Case Western Reserve University. Welcome, Dr. Payton. And next
Thank
we
you.
have Dr. Lloyd Talley, is an applied developmental psychologist whose work advances digital racial literacy and equitable brain and behavioral health across the lifespan. He is an NSF professorate, advancement fellow, and director of the Hampton University Behavioral and Health Lab, where his team studies how everyday technologies, social media, and emerging AI systems shape cognition, emotional regulation, stress, identity development, and long-term health outcomes for Black communities from adolescence through older adulthood. He also leads the Black Digital and Civic Futures Project, which translates research into practical tools that promote healthier technology use and civic empowerment. In addition to his academic leadership, Dr. Talley serves as senior advisor for NYC Computer Science for All, created the Exploring Equity in Computer Science program, and is a co-author of Advancing Educational Equity in Computer Science. Across research, policy, and public scholarship, his work centers on empowering Black communities to navigate technology in ways that support brain health, dignity, and collective flourishing. So welcome, Dr. Talley. So
Thank you
happy
for
to have
having me.
both of you here. I'm looking forward to us having a great conversation and discussion this evening. Dr. Talley, let's start off with a question for you. And
Okay.
Dr. Payton, you can definitely chime in as well. How can tools like telehealth wearables and remote monitoring improve self-empowerment and continuity of care for patients who may otherwise face barriers to in-person visits?
So I think whenever I think about one, everyone, thank you for having me here. I'm so happy to be having this conversation. I think, especially in community of color, we need to be having more critical conversations about the rapidly evolving technical sphere and how we fit into that, but also how to be resilient in that environment. And so I'm just really excited to be here to begin with. But to your question, I think the innovation that's coming through AI, but also digital and wearable technologies, kind of presents almost a paradox to the ways in which we used to think about data, health, and people of color before, right? In many ways, we always kind of saw people of color on the outside and not always having access to the latest providers, the latest care, and also the best data collection, right? Meaning, like, sometimes it felt like the data that was about our community wasn't in our own hands, right? And so as we get things like wearables, I'm even wearing an Aura ring right now, for instance, right? I think in many ways, it's one of the first times that we can take advantage of technology to monitor and self-determine our own health in many ways, right? Like we can see the data. The doctor doesn't have to tell us about the data necessarily, right? I mean, the doctor will inform us, but it's coming from our lived experience, and we have some level of can have some level of trust with maybe even managing our own data for the first time in ways that in the past we really had to rely on providers, and especially when we had barriers in our community like trust issues between people of color and providers. I think small empowering things in the everyday world like wearables helps to give us some of that power back, right? We don't live in a perfect environment, but it helps us to have a little bit more of that self-empowerment. And so I'm going to tell you where that comes from for me, not only my research, but the reason why I have an aura ring is from my mom, right? She is in the generation, like kind of in the boomer generation. But she told me, she said, I've been worried about my sleep. I've been worried about my health. And this ring has helped me to see the things that I might not have been paying as much attention to before, right? Something that if I went to the doctor, I might not necessarily tell them about, right? And so I feel like in many ways, empowering us with the data to also show our concerns to our healthcare providers, right? It's collecting data, ongoing monitoring. If I'm having a stressful experience, I can show on my Aura Ring data that like I did have a stressful experience that day, right? That my heart rate has been at a certain level for a while. And so I think the most prominent thing for our community that I feel is maybe taking some of the ownership of our data back and being able to narrate our experience with the data where sometimes our experiences are invalidated, right? And so I think that's the most exciting
Hmm.
part about it for me. I think the
Hmm.
second most exciting part about it for me is that it is ongoing data collection, right? In a way that is not as invasive as as like both clinical and research have kind of used these tools in the past, right? A lot of times these have been very cumbersome systems. So now we have sleek EEG headbands where someone doesn't have to be linked to all of these different electrodes to even begin to like kind of lower the barriers to entry to using these technologies and also to make us feel like we have a place that these things can actually be used for our health. The final thing I think I'll say about the wearables is that we also have this amazing opportunity to be so much more proactive about our brain health. I'm thinking about the brain training softwares where we actually can have real-time EEGs, where we're doing things through interfaces on our phone, where we're actually doing real-time brain training to get ahead of some of the cognitive issues that we may experience in the future. And I don't really think that we've ever had access or even a glimpse of access to having that level of technology at our disposal to use for our own well-being. And so I think that that's kind of what makes me really excited about this space for us.
Thank you. Dr. Payton, would you like to respond or expand or share
I
your
don't think
thoughts?
so. I don't think that I would expand on anything with regard to that. What I will say is it is interesting to hear why, what, and what wearable.
Mhm.
And part of what I'm hearing in the response is it is family driven. It is generationally driven. And I think for me, I am and have always been very, very interested in the data. And I always say in my presentations, given my background, data is the only asset that's not on the balance sheet, but it's very key now in healthcare and in other areas. And in particularly for healthcare, right? And I think it's about a mutual relationship with a physician when it comes to whatever wearable device that you may have. The
Hmm.
last thing I will say, this is about clinical decision making for a patient. Physicians have to make clinical
Hmm.
decisions, but as patients, it gives us an opportunity to make more informed decision making. But also, I think some of what the devices do, the devices are collective of certain types of data. And there are other types of data that those devices don't pick up if we are if we are solely focusing on Black and brown communities. Let's be realistic about this, right? That there are some things that these devices, I'm wearing one also, it's not a ring, it's a watch, they
Mhm.
do not pick up. And so part of the context of us is missing, right?
Yes.
The
Would you
device,
share with us like an example of what?
absolutely, an
Hmm.
example of historical history, right?
Mhm.
Um, I would say generational health issues. Those things are not necessarily picked up because the device you're wearing the device on the data. In a lot of ways, that means the device itself, like the algorithm itself, must be trained.
Mm,
And that
Yes.
that piece is not done just by simply wearing a device.
yes,
Environmental issues, it may not pick up on environmental nuances, um, environmental exposures. Those things the patient knows clearly about given the lived experience. And so I think while I am hopeful about these things, I'm very realistic that there needs to be a human in the loop at all
Oh,
times,
yes.
yes.
at all
I
times,
yes,
at all times. And let
yes.
me say this about human in the loop.
Mhm.
I'm going to go even further. It depends on the type of human, right? And the
Yes,
understanding of the human and the
yes,
nuances of the human in that loop that make a difference.
yes.
Right.
I love what both of you have shared in response to this question. I love, Dr. Tally, the piece that you said about wearables as empowerment and also a tool to validate some of the things that we experience. You know, last webinar series, last Thursday, we talked about the impact of like stress on certain populations and how
Absolutely.
trauma is real and the impact that it has on our health. One of the takeaways, I am not a scientist, so much respect to both of you. But one of the takeaways I had from last week was how being exposed or living in a state of constant stress can set off chemical processes and reactions in the body that can
Hmm.
over time sustained change
Yeah.
our baseline of health and the impact that
Absolutely.
can have on brain health and things like that, right? So thinking of wearables as a potential tool to validate some of that, I thought, and for us to think about how we reclaim um, our data and use of our health data through using wearables was a refreshing perspective. I also really love what you said, Dr. Payton, about humans being in the loop and how these data, the wearables don't necessarily capture all the data that really affects us. And so
Mhm.
that leads me to a question which I think dovetails from your answer to you, Dr. Payton. And of course, Dr. Talley, you can respond after Dr. Payton if you have anything. But Dr. Payton, how can developers and institutions in your expertise proactively reduce bias when designing or deploying health-related AI and digital tools?
Oh, there's so many things, right? Let me start with this.
Mhm.
There are multiple types of biases, and developers and users need to be aware of this, right? So there are multiple types of bias, and most times we sort of think of bias as a binary construct.
Mhm.
Bias comes in many forms, right? So there are data biases, right? And those data biases should developers should be asking the questions. Um, First of all, who's on my team? Who's on the team? I've been in some of these rooms and it's like, this is the team? Okay. So in the data bias area, right? In the data set bias area, is the data representative? Is it really going to answer the question that has been asked? And that if the data is not representative, then it falls short to begin with. And then, even once developed, there are association biases that may say, oh, you're trained on this, so this variable must be associated with so and so. There's a leveling up in design and reinforcement that may multiply biases. And then there's an automation bias. I mean, you see them all the time where the system will do an override, right? You type every day and it'll spell it out for you. It overrides. It's like, no, I actually intended to spell my name as such. You see it every day in a use case. And then there's the interaction bias where humans interact with AI and sort of create biased results. And these are, you characterize Black patients based on
Mhm.
their, lack of trust in something and creating almost a trope. And then there's the confirmation bias that overly really simplifies personalization that makes the case about an entire group when you have results related to one individual, right? And we've seen these in different forms in healthcare. And the example that I really like to land on as I answer the question is C-sections versus vaginal birth, right?
Mm.
Who gets the C-section versus the vaginal birth? And there are consequences when you have cesareans, right? But the predictability of some of the AI modeling has shown that there's a lower likelihood of success for African Americans and Hispanics when it comes to cesareans. Yet
Mm.
cesareans are often the prescribed route for birth for whatever reasons, right? Whatever the model says. So understanding that there are multiple forms of biases, understanding that we all bring biases to the table,
Mhm.
but this question of who's sitting at the table is very critical. And I always say in healthcare in particular, it's not enough to be just a computer scientist or an engineer. You need to understand the domain specific areas of healthcare. So, therefore, there needs to be some understanding of how healthcare systems work, how the MLs are formed, how the AI has been moderated, invented, created, and by whom, and how has it been trained, and what data has it been trained on. So, I think this is very critical when it comes to biases. You gave the example, and the last thing I will say, you gave the example of telemedicine coming for a place where telemedicine was, pretty much a norm, and telemedicine centers usually hitting or being made available because of rural populations. And now, given what we've experienced with COVID, telemedicine is taking on a very different form, especially when it comes to a one-on-one with a physician or diagnoses. The assumption that a patient will have access.
Mhm.
That means you need to have some level of broadband access
Yes.
to get the throughput through the pipes
Mhm.
to actually do something like this. And so I think those are some of the things that when it comes to biases
Mhm.
that need to be addressed. And I could say more, but I'll end there.
I love everything that you said. And again, I keep hearing the strong theme of how much representation, expertise is not enough. Like expertise plus representation and understanding is very important. Dr. Tally, would you like to respond?
Yeah, yeah, I think also looking at bias from the very human like pipeline to the profession level as well, right? A lot of what we talk about in New York City Computer Science for All is how are we preparing students who are just high school students who are learning computer science, just in their first couple of years of undergraduate learning about computer science to have this culturally responsive lens of recognizing that when you're creating technologies, you need to be human centric, right? You need to consider all of the different humans who may be impacted by this technology, because especially in those formative years when they're just developing their identity as computer scientists, you want them to think, especially in the case of like wearables, right? You want them to ask the question well beyond before it gets to beta testing, has this been tested on darker skin tones, right? You want these questions to be a part of their thinking in the process of them developing these technologies. And so we often wind up having this issue in the technological workforce of individuals who've really not been pressed to almost even develop their own awareness of their bias around the technologies that they're bringing into the world, and if these are equitable technologies, at the very least, that the people who these technologies will touch have been either included or considered in the formation of the technologies in and of themselves, right? And then also, I think we start to run into an issue because all technologies are not created in an altruistic way, right? And so some of the people who they're creating these technologies for, they're worried about who the consumer will be, right? So even especially like with consumer or like with commercial or consumer facing wearables, right? How do we even know that these were created for us? And I think this goes back to Dr. Cobb Payton's point, right? Around who's in the data sets, right? Who have these things been tested with? Whose lived experiences have been considered here? And so I think in some ways we have to make sure that even in the pipeline to individuals becoming now, the technological leaders of our society in some way with their power and capacity, that they have started to cultivate this digital racial literacy within themselves, right? It's almost like a new competence that they need to understand. How are these technologies marginalizing others, and how can we make them more equitable as well, because
Yeah,
it's built into the algorithms, everyone. It's just reflecting our society, right? It's not some
right.
pristine ideal place where prejudice and bias has never existed before, right? It's bringing exactly what we put into it from our world into the way that it makes decisions about our future.
Yeah,
Absolutely.
and this so this requires, I certainly agree. I'm sorry, I didn't
No,
mean
that's
to
Oh,
okay.
you're
Go
cut.
ahead.
fine.
Go ahead.
Yeah,
Go ahead.
but what I will say, this is not a computer science issue alone.
No,
This
not
this is
alone.
not this not alone. This is not a computer science issue. I could say that being one of them. I mean, we need ethicists at the table. We need arts people at the table. We need we need all kinds, because the CS for all model is about CS and computer science. Know the program well, but what I will say is, what about little Johnny over there who has great ways of thinking about it? And now we need to reorient our way of conceptualization of this. Definitely from the cultural perspective, I certainly agree with you. I sort of call it and written about design justice. You have to ask the
Mhm.
design justice question.
Yes.
And that design justice question sort of raises the issue that's in the chat that says, who or what in what places monitor these things? There's a life
That was going to be
cycle.
my next question.
There's a life cycle. There's
Yeah.
an AI life cycle. There's a data life cycle, particularly for healthcare applications. And so it's creation, it's acquisition, it's model development, but there's evaluation. And that evaluation requires that there's a feedback loop. And those feedback loops should provide some checks and balances, whether it's AI systems or whether it's wearables. Those checks and balances are critical. And always, again, having that human into the loop,
Yep.
particularly doing and prior to, like you said, like Dr. Talley said, doing the beta testing, not
Mhm.
at the end. What has happened so much is the development has happened. It's like, oh, it's a wonderful world, build it and they will come. But you build it and they will come, and then there's no understanding of difference or differentiation that may take place in the use and the deployment of these technologies. And actually, we need to be creators. We need to
Yeah.
be more creators in the process.
And I have another question to dovetail off of what you just said in reference to the checks and balances. What are your thoughts in terms of what we see happening in our country with, funding being removed from institutions around having more representative diversity and equity? And so how do we advocate for checks and balances if there is an active culture um against really embracing and having diversity and equity included in all the spaces? Like, how do we have that design justice. I love that term. I've never heard that before, but that is
Hmm.
so powerful, right? In this current political climate, how do we, especially as communities of color, um, advocate for design justice, given some of the current agenda around diversity, equity, and inclusion, or non-inclusion?
So, so I would ask the question back. The the life cycle is a scientific method. Is the scientific method a DEI issue, or is it a scientific method? And so the the to me, how I see this, it takes and requires a great deal of work. However, this is the scientific process. And you pose it as this is part of the scientific process, part of the life cycle of development, of technology development. And the questions that we're raising and the issues that we are asking happen to be a part of that evaluation stage. But really, it starts at the very beginning of the scientific process. And I think what we have now is so much of anything that you do is seen as is DEI, but this is part of the scientific process. I'll say two things. There is the return on investment, which Dr. Talley brought up about altruistic organizations or not, right? So there's always the profit motive, there's always the talent motive, and then there's the altruistic motive. Well, this is a national competitiveness issue. This is about talent. As Dr. Talley mentioned, CS for All, getting folks trained and going back through the pipeline. So I think these are the kinds of questions or positioning that could perhaps stand up to some of this.
Thank you. I want to toss up a question for both of you. How do you see generative AI influencing healthcare decision making, and what
Hmm.
safeguards are necessary to ensure responsible use? And that's open for either one of you to respond to.
So in many ways, as I was thinking about this question, I was kind of come to a paradox, right? Because on one side, the first thought is people are going to have an over reliance. Like let's even beyond just brain health. Let's just think about people using ChatGPT as a therapist, right? Like people are having
Right.
this over reliance on systems where there is not another responsible human being, right? They're there in times of vulnerability using these technologies, and there is not another human there to kind of help them to navigate that. And the AIs are designed to
Mhm.
kind of please them, right? And inherently, many of the algorithms are designed to please us. And so as soon as I get halfway through that point and thinking about the role of doctors and clinicians, I also have to think about how realistic is this concern, because with the amount of, especially with wearables, et cetera, the amount of data that some of the AIs will have about the individual patients will
Mhm.
be more than their actual doctors can with the state of healthcare, right? When doctors only have 10 minutes to see a patient, the AI has been following them
Mm.
on the ring
Mm.
for the past 4.5 months, right? And so I'm hoping that actually, back to Dr. Cobb Payton's original point, right, it becomes a symbiosis between clinician and data, right? That the clinician is recognizing what the issues are, that they cannot attend and monitor their patient every single day, all day, but they can learn how to be competent around the data and the issues of equity within the data as they're interfacing with culturally different patients, especially to them, to actually be able to utilize the information for obviously for the health of the patient, but really for the
Mhm.
synthesis of what's going on in the patient's everyday life that the clinician cannot see, and also the clinician's fair assessment and expertise in this subject area.
Mhm. Great points. Great points. Um, yeah, I think great points. I would just say one thing that stands out to me in this question
Mhm.
around Gen AI, the sheer amount of data, like Dr. Talley said, the device gets more information than the doctor, gets
Mhm.
more data than the doctor. But I think it is really incumbent upon us to understand that in this era, that data literacy is a skill that we all need, particularly when it comes to healthcare. If we are going to have patient-centered, personalized healthcare, that that data literacy part requires that there's another skill set that we all
Mhm.
need in understanding something that was beautifully mentioned about Dr. Talley was the life cycle and the disease cycle and the age cycle. Those things are very critical when it comes to wearables, Gen AI, and how we can engage with the data that comes through on the device.
So I'm going to ask you, based on your response, Dr. Payton, uh, what training or education do clinicians need to effectively and responsibly integrate AI-driven tools into their practice?
Well, a lot, right? So what I will say, I will start with this. We talked about the cultural nuances,
Hmm.
right? We talked about the cultural nuances. Um, there, of course, is the clinical aspect. I think workflow is very critical. Um, Workflow understanding and how it differs when there are wearables and AI and community support and diagnostics and telehealth, telemedicine involved. And then there's the overall aspect of what does it mean to have a what is the bedside manner? That's a totally different aspect when you're talking about how the doc will deliver healthcare or recommendations. And so I think those three areas are quite critical. Beyond, okay, yes, they need to understand the technical, aspects of what they are, what's coming out of an AI system to have discernment, because that's not to say just because the recommendation is from the system that you need to act upon it. You need to interrogate that relative to the context of your patient and what have you.
And before we move off of this, I
Sure.
just want to add
Mhm.
one thing. I think to my initial point, it also gives us the data ourselves to see. It enhances the transparency. And so now your doctor might be recommending something, but you can see the same data in the same way. And honestly, if it's an ongoing monitoring system, you have some a fair level of competence because you see it every single day, right? And so I also think like at a certain point in time, all the tech was in the doctor's hands in office, right? Now we have a little bit of a window into it. And so if the doctor's like, you're fine, but you're like, no, my heart rate variability has been up for the past 3 weeks, that changes the conversation. That changes our
Mhm,
own health literacy, right? To be able to say,
mhm,
no, doc, I see the data and I believe the data because I felt it and I validated it real time when it happened. And now I'm coming in to figure out what's going on. And if you don't agree with me, well, then now I also know I can go get a second opinion.
mhm.
Thank you.
Exactly.
Before we move on to our next question, which I'm going to toss this next question to Dr. Talley, I just want to share a few brief comments from the chat. And thank you to the audience participants and for using the chat. Venetia Thomas says, but there can be bias in the design of the device. Clinicians can get lazy by assuming just because of your ethnicity, they will give you certain drugs and not consider others. And Yvette Hunt says, perhaps a new skill set is waiting to evolve. We can only relate and define things based on what we know, experience, and imagine in our present lives. Thank you both, and to the audience again for sharing in the chat, and please continue to put questions and comments there. Dr. Talley, from a
Yes.
clinical or research perspective, where do you see the greatest promise for predictive technologies in neurology or brain care?
Mm,
So the same thing that I am most worried about in everyday life, I am most excited about in clinical and research, right? Ongoing data surveillance in inconspicuous ways has been a dream of researchers for years, right? To literally
mm,
be able to follow your participants or your patients everywhere they go without it being cumbersome and annoying to them has been something that, we've been waiting for a long time. I even remember when I first started, I was interested in something called ecological momentary assessment, right? Where you get like text message bubbles that you might answer surveys on your phone throughout the course of the day. And I was excited about that then, now, right? Now my Aura watch in the morning can say like, and you may not feel it yet, but you're having some symptoms of being sick. So you should take it easy today, right? And that forward monitoring. And so I think in the research and the clinical realm, that ongoing surveillance is something that makes me really excited, both for real-time response, but also to corroborate research and patient experience, right? But
Mm-hmm.
then
Mm-hmm.
that same thing is what makes me nervous about it in terms of having big tech and data everywhere and having nationalized or even state by state surveillance in some ways, right? Because we also have a weird relationship as communities of color with who has our data, who can follow what we're doing, who's monitoring us, because we have had legitimately negative experiences of people using our data, our bodies, our biological specimens, and otherwise for nefarious things in the past, right? I'm thinking Tuskegee, I'm thinking Henrietta Lacks, right? Like I'm thinking these
Mm-hmm.
experiences where we actually do should have some fear about how our biological data is being used and being surveilled. And right. And so there's part of it that makes me real excited because we can surveil our own self and have access to these technologies that were very, very difficult and very cost prohibitive to come by a long time ago. But also, it's the thing that now it makes me even more focused on data security, making sure that the data that I collect is being protected well, making sure that, especially now we can collect such many more diverse forms of data, right? I can be collecting saliva samples, I could be collecting heart rate variability, I could be collecting sleep data all at the same time. But also now my burden to protect that data is much higher, especially within the cultural lens.
That's right. That's right. I hear here. I definitely agree with that. And that response from Dr. Talley lends itself about my response about what does it mean to be data literate in
Mhm.
this context, right? It's all of that. It's not just understanding the numbers that come from the Oura Ring or the Apple Watch or the Fitbit, whatever you may have on. It really is about longitudinal data. It's about longitudinal data and it's about the course of the life cycle and recognizing again that the partnership between the clinician and the patient takes on a different tone. And sometimes that tone can either create a long-standing relationship or it can challenge existing norms because typically the physician is, is the captain of the ship,
Mhm.
right? Yeah. And so and because ethnicity may come into this, there may be different pressure points or different relationships or pivots because of that data and the literacy that comes along with it, the patient may challenge or the patient may question. And you can often say that that comes because you're seeking to understand and to do what's best for your body to govern your health.
Yes. I'm gonna we're starting to wind down on time, but we still have about 9 minutes or so. I'm gonna
Mhm.
ask you kind of like a combined loaded question, Dr. Payton, and then
Oh
give Dr.
boy.
Tally an opportunity to respond because I feel like both of these questions touch on what we've just been talking about and what you highlighted in your answer. So the first part of this like two-headed question is
Mhm.
what concerns should patients have about data privacy and data use when engaging with health apps, wearables, and AI-driven platforms. And then the
Mhm.
second part is how does unequal access to technology shape who benefits the most from digital health innovations and what strategies show promise for narrowing that gap?
That's three questions. So
We're trying to cram a lot in like
that's a
8 minutes.
lot.
I'm so
That's a
sorry.
lot. That's a lot.
Yeah.
So on the concerns about
Yes.
um, data use, whether that data is anonymous, whether it's confidential, how it will be protected, how can you have access to your own data, right? That is an issue, and that still is an issue. Who owns the data?
Mm,
What we have not talked about in this conversation when it comes to data use is how does what's here on my watch or your ring and the data you share with this physician, how does that enter into the electronic health record?
mm,
Because there are things that happen in the electronic health record that then inform population health and then talk about clinical trials and on and on and on. So I think that's one. unequal access means that the population health that is very important. I'm just going to use the word right now when we're talking about pandemics, epidemics, those become either underreported, unknown, and could have um, high impact stressors in many ways, particularly for underserved populations. And the third piece, I've forgotten what you asked. I was trying to get to that.
Let's see. Who shaped strategy? So, how does unequal access to technology shape who benefits most from digital health innovations, and what strategies show
Mm.
promise for narrowing the gap?
Strategies that show narrowing the gap.
Mhm.
I think going back to the education piece that Dr. Talley talked about is critical. I think understanding and challenging design methods that could be in place. Thirdly, I think questioning the data that you see, is it your truth, your real truth, and get an understanding of what are your norms. And I think that that's been really important for me when it comes to when I think about this idea of generational health that we talked about earlier. So I'll just put a pin right there.
Thank you. I want to squeeze in one more question. We'll toss this to Dr. Lloyd Talley. How should clinicians and practitioners incorporate screening of problematic technology use and AI exposure into the cognitive well-being of their patients?
Yeah, I think actually this is one of the under discussed elements of the AI revolution, right? Because we have like wearables and tech, but we also are living in algorithmically mediated environments, right? Like how many of us are spending 3 or 4 hours a day with technologies that are influencing us without us really knowing like how and why we're using them or really monitoring and self-regulating our engagement with them, right? Because when I think about brain health, I'm thinking about long-term cognition. I'm thinking about memory, right? I'm also thinking about like emotional regulation, right? Like also being able to monitor the stressors that you're seeing in real time. So I think one of the areas that we don't talk about as much are things like social media, right? And recognizing that honestly, social media and digital, like algorithmic technologies, are becoming a moderator in our everyday cognitive and emotional well-being, right? So for instance, in the work that we're doing here at Hampton, we're actually finding that like so many of our students basically are like borderline technology, social media addicted, right? They actually are not even aware that they're having these struggles, but when they take a step back, some of them have to get counseling for this. Some of them actually are having to like do like, but they call it like, we call it digital intentionality projects, right? So like detoxes, right? Like 1 month by replacing habits, so on and so forth. But with this notion of the digital divide, I think for us as people of color, we also are not fully aware of the challenges and the dangers that happen for us cognitively and physiologically through these technologies, right? Because these algorithms are interfering with our memory. They are interfering with our sleep, right? Which is major for cognitive health. And so I think really we also have to not be so far behind on the digital health and digital wellness train, and like the digital divide for African Americans can't continue in the same way because our health and knowing about how these platforms and how these technologies are impacting our health in ways that we're not always aware of is something that we can't be too far behind with, right? It's actually impacting us as a culture, right? Not just individual societies. It's not
Mhm.
just Gen Z. It's not just the kids. It's all of us because at the other end of the life course, we also have our elders who are being targeted using algorithms to scam them, right? And being deceived in the cyber world, right? So I think as much as the wearables are important, also the technologies that we're hoping will change the future also might be creating in the same vein some of the issues that we'll be detecting in the future, right? And so I also think we can't forget about developing our own digital intentionality, right? Self-regulation, self-determination, and literacy with how we use these platforms and technologies, honestly, before it's too late.
Dr.
Mm. Okay.
I'll give you maybe like 60 seconds to respond because we have like 2 minutes, and I'd like
Okay.
to give you
Okay.
the opportunity to
Okay.
wrap. Mhm.
Okay. So I definitely agree with all that. I want to add on to what Dr. Talley's talked about in terms of the mental health component, having published research on the use of technology, AI, and using natural language processing to look at how college students actually use technology and how it really impacts their mental well-being, I think is really important. And I agree, it's not just college students, it's all of us. Two things we haven't talked about, and I just want to say this, it's not just the access to care, it's the quality of care that we have access to, right? Is important when we're talking about wearables, AI, and community. Secondly, last thing I'll point out, no disease lives in isolation. So understanding comorbid conditions, comorbidities are critical in understanding how AI can be used to understand those connections between and among disease episodes. So mental health may come along with depression, but may come along also with, for instance, is there diabetes and heart disease? So looking at those diseases that cling together are going to be really important when we're talking about brain health as well. And I'll end with that.
Thank you. I'd like to ask each of you again briefly, if you would share maybe just one more final thought, a piece or key takeaway that you would like our audience to remember from our discussion tonight.
Dr. Talon?
I'll kind of just say what my students say. They say technology is not harming us. The way that we choose to use it is what determines whether or not it harms us. And so I think that that means that we need to both be literate around the cultural elements that we may be exposed to racial bias and harm and be aware that that's occurring in the same way that we are aware of it in our everyday worlds, but also don't be so shy or so turned off by technology that we don't use it for the things that actually can empower us to change the status of our health and our community's health.
Yeah.
Thank you.
Um, wise coming from the students, right? Yeah, I would say I still am a huge proponent in saying that while there is technology, that tech is not the only solution. I think particularly when we're talking about ways to which to protect the brain, we have to think about natural ways of protecting the brain. Um, are we exercising? Are we meditating? Are we enjoying nature? Are we, um, what are we consuming? So I think all of those things, and if we can help to regulate those things as much as possible, I think are very important. And lastly, I'll land on this, what I said. These devices give us numbers, but we all know and have to take into account our context. And that context is our lived experiences, environmental issues, environmental factors, our medical backgrounds, our family history. All of that needs to be taken into account to get the full picture of who we really are.
Absolutely.
I love this. Before we wrap, I do want to share just a brief comment from the chat. Joy
Oh,
Powell, I appreciate the responses that have touched upon some of the subject matter. Uh, let's see, the importance of sleep, environmental contributing factors, our history of hesitance to involvement in research. Awesome topic tonight and all month long. We'll miss these Thursday night webinars, great speakers, and thanks to all who put this series together. Thank you, Pariana Fatisha. I hope I said your name, Fatika. I hope I said that right. And
hmm.
let's see who else. Excellent information. Thank you so much for your time and your hard work. Amazing webinar series. I want to say thank you to Dr. Talley and thank you, Dr. Cobb Payton, for joining us this evening. I feel like we're really just getting started, even though this is such a deep and rich conversation that we have been having. But that does bring us to the end of the 2026 Black History Month Brain Health Webinar Series. Thank you for tuning in to this year's series. All webinars in this series are recorded, and links to the recordings will be emailed to registered participants after tonight's session. You will also receive a feedback survey by email, and this final webinar survey will include some additional questions to close out the series. We will continue collecting surveys from viewers for an additional week following tonight's session. Your feedback plays an important role in shaping future topics and programs, so we encourage all participants to complete the emailed surveys for each week's session. That's for each week, even if you are viewing this webinar as a recording. Again, I'd like to thank our esteemed panelists for joining us tonight, as well as the webinar series planning committee and the planning leadership team, Lindsay Campbell, Susie Sammy, Shristi Ahuja, and Gordon Williams. Happy Black History Month. Let's take care of our health and our brains, and see you next year. Thank you.